Hello! In this video, you will see how DOVATO, an innovative approach to treatment with dolutegravir and lamivudine, inhibits the HIV life cycle at 2 separate sites, like a traditional 3-drug regimen. Indication: DOVATO is indicated as a complete regimen for the treatment of human immunodeficiency virus type 1, HIV-1, infection in adults with no antiretroviral treatment history and with no known substitutions associated with resistance to the individual components of DOVATO. Important safety information. Boxed warning. Patients co-infected with hepatitis B virus, HBV, and HIV-1. Emergence of lamivudine-resistant HBV and exacerbations of HBV. All patients with HIV-1 should be tested for the presence of HBV prior to or when initiating DOVATO. Emergence of lamivudine-resistant HBV variants associated with lamivudine-containing antiretroviral regimens has been reported. If DOVATO is used in patients co-infected with HIV-1 and HBV, additional treatment should be considered for appropriate treatment of chronic HBV. Otherwise, consider an alternative regimen. Severe acute exacerbations of HBV have been reported in patients who are co-infected with HIV-1 and HBV and have discontinued lamivudine, a component of DOVATO. Closely monitor hepatic function in these patients and, if appropriate, initiate anti-HBV treatment. Contraindications: do not use DOVATO in patients with previous hypersensitivity reaction to dolutegravir or lamivudine. Do not use DOVATO in patients receiving dofetilide. Additional important safety information for DOVATO will be presented later in this video. The HIV life cycle offers potential inhibitory steps that can be targeted by antiretroviral therapies, from binding and fusion at the host cell surface, to reverse transcription of viral RNA into viral DNA, then integration of the viral DNA into the host genome, and finally, formation of new viral particles through viral replication. Assembly and budding. For treatment-naive patients, the traditional standard of care is a 3-drug antiretroviral regimen that acts at 2 separate sites in the HIV life cycle. Typically, the 3-drug regimen consists of 2 nucleoside reverse transcriptase inhibitors, or NRTIs, combined with an integrase strand transfer inhibitor, or INSTI, a non-nucleoside reverse transcriptase inhibitor, or NNRTI, or a boosted protease inhibitor, or PI. Similarly to traditional 3-drug regimens, DOVATO targets 2 different sites in the HIV life cycle. Dolutegravir, an INSTI, inhibits HIV integrase activity by binding to the integrase active site, thereby blocking the strand transfer step of retroviral DNA integration, which is essential for the HIV replication cycle. Dolutegravir is an unboosted INSTI with an elimination half-life of about 14 hours. In vitro studies have shown that dolutegravir has a dissociative half-life of 71 hours. Lamivudine, an NRTI, was paired with dolutegravir because it inhibits the HIV life cycle at a separate site. It is converted intracellularly to lamivudine triphosphate, which inhibits HIV reverse transcriptase by inducing DNA chain termination. Lamivudine has an elimination half-life of 13 to 19 hours. As you have seen, DOVATO follows the principles of HIV antiretroviral therapy by inhibiting the HIV life cycle at 2 separate sites, like a traditional 3-drug regimen. DOVATO is a complete, once-daily, single-tablet, 2-drug regimen for treatment-naive adult patients with HIV-1. Please see the following important safety information for DOVATO. Important safety information. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions have been reported with dolutegravir and were characterized by rash, constitutional findings, and sometimes organ dysfunction, including liver injury. Discontinue DOVATO immediately if signs or symptoms of severe skin or hypersensitivity reactions develop, as a delay in stopping treatment may result in a life-threatening reaction. Clinical status, including liver aminotransferases, should be monitored and appropriate therapy initiated. Hepatotoxicity. Hepatic adverse events have been reported, including cases of hepatic toxicity, elevated serum liver biochemistries, hepatitis, and acute liver failure in patients receiving a dolutegravir-containing regimen without pre-existing hepatic disease or other identifiable risk factors. Patients with underlying hepatitis B or C or marked elevations in transaminases prior to treatment may be at increased risk for worsening or development of transaminase elevations with use of DOVATO. In some cases, the elevations in transaminases were consistent with immune reconstitution syndrome or hepatitis B reactivation, particularly in the setting where anti-hepatitis therapy was withdrawn. Monitoring for hepatotoxicity is recommended. Embryo-fetal toxicity. Alternative treatments to DOVATO should be considered at the time of conception through the first trimester of pregnancy due to the risk of neural tube defects. Perform pregnancy testing before use of DOVATO and counsel that consistent use of effective contraception is recommended while using DOVATO in individuals of childbearing potential. Lactic acidosis and severe hepatomegaly with steatosis. Fatal cases have been reported with the use of nucleoside analogs, including lamivudine. Discontinue DOVATO if clinical or laboratory findings suggestive of lactic acidosis or pronounced hepatotoxicity develop, including hepatomegaly and steatosis in the absence of marked transaminase elevations. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of DOVATO and other drugs may occur. See contraindications and drug interactions. Immune reconstitution syndrome, including the occurrence of autoimmune disorders with variable time to onset, has been reported with the use of DOVATO. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 2% all grades, with DOVATO were headache, 3%, nausea, 2%, diarrhea, 2%, insomnia, 2%, and fatigue, 2%. Drug interactions. Consult full prescribing information for DOVATO for more information on potentially significant drug interactions. DOVATO is a complete regimen. Co-administration with other antiretroviral medications for the treatment of HIV-1 infection is not recommended. Drugs that induce or inhibit CYP3A or UGT1A1 may affect the plasma concentrations of dolutegravir. When co-administering DOVATO with carbamazepine or rifampin, take an additional Tivicay, dolutegravir, 50 mg tablet, approximately 12 hours from the dose of DOVATO. Administer DOVATO 2 hours before or 6 hours after taking polyvalent cation-containing antacids or laxatives, sucralfate, oral supplements containing iron or calcium, or buffered medications. Alternatively, DOVATO and supplements containing calcium or iron can be taken with food. Use in specific populations. Pregnancy. There are insufficient human data on the use of DOVATO during pregnancy to definitively assess a drug-associated risk for birth defects and miscarriage. An antiretroviral pregnancy registry has been established. If planning a pregnancy, or if pregnancy is confirmed while taking DOVATO during the first trimester, assess the risks and benefits of continuing DOVATO versus switching to another antiretroviral regimen. For individuals actively trying to become pregnant, initiation of DOVATO is not recommended unless there is no suitable alternative. Lactation. Breastfeeding is not recommended due to the potential for HIV-1 transmission, developing viral resistance in HIV-positive infants, and adverse reactions in a breastfed infant. Females and males of reproductive potential. Perform pregnancy testing before initiation of DOVATO. Advise individuals of childbearing potential to consistently use effective contraception while taking DOVATO. Renal impairment. DOVATO is not recommended for patients with creatinine clearance less than 50 milliliters per minute. Please see full prescribing information, including boxed warning, for DOVATO at dovatohcp.com.